Welcome guys to our channel today. It's been some time, but we're back. Have a very interesting topic, and today we have, and that topic is called the causes of vaginal bleeding after sex. Some people experience this kind of a problem during sex or after sex. Why should one experience bleeding after sex? So that's what we're going to discuss today. So vaginal bleeding after sex, medically known as postcoital bleeding, can occur for various reasons, some of which may include, I'm going to mention just a few of them. So number one is about trauma or injury. If one has an injury that is through friction or rough sexual experience, may cause small tears or injuries to the vaginal tissue or the cervix, and this may lead to bleeding. Number two is about cervical ectropion. Cervical ectropion. These are conditions which occur when cells lining the cervical canal are present on the outer surface of the cervix, so that these cells are more fragile and also prone to bleeding, especially after the sexual activity. So when you find the cells which are supposed to be inside the cervix are outside the cervical canal, you get that the outer surface of the cervix may have a problem. So when you get that kind of friction, one may be predisposed to that problem of vaginal bleeding or postcoital bleeding. Another problem you may get which may cause vaginal bleeding is what we call infections, especially the STIs or the sexually transmitted infections such as the chlamydia, gonorrhea or trichomoniasis may cause inflammation and also may cause the bleeding for the particular individual. So because these infections cause inflammation and bleeding may occur on the vaginal tissue. So also other infections like vaginosis may also contribute to postcoital bleeding. Kindly, if you don't know these infections, I've talked about sexually transmitted infections in our previous video. You can go back and check in our videos. There's something very important, and I'm going to link that video to this so that you may easily find it in our channel. So another thing which may be causing this bleeding is what we call cervical dysplasia. When we talk about cervical dysplasia, that's the abnormal changes in the cervical cells, known as cervical dysplasia, where this also may be the main cause of vaginal bleeding or after sex bleeding. Also, when we have what we call vaginal dryness, there's a video I shared about how you are supposed to prepare if you are experiencing this dryness during the coitus interaction. It's very important that you get to make your vagina lubricated, and how your partner is supposed to prepare you to lubricate well. So if you have also not watched that video, kindly watch our previous video. So vaginal dryness can cause that one, and sometimes vaginal dryness is also a common thing in the ladies who are on the menopause, that is their past reproductive age. So vaginal dryness can also be one of the symptoms of menopause, and also other conditions like shared in the previous video which cause such kind of problem. Also, because of the dryness, we have friction and irritation resulting in vaginal bleeding. Another cause which can happen, that's the seventh cause, is about hormonal changes. The lady's body changes from one time to another depending on various factors, and and most of those factors are hormonal controlled, like during pregnancy, like during menopause, but like during stress, one may experience a few changes in the body. So fluctuation in the hormonal levels, such as during pregnancy, menopause, menstrual cycle, when one is in the menstrual cycle, can sometimes lead to postcoital bleeding. Another very detrimental and not very interesting, what we call vaginal or cervical cancer. That is in rare occasions. So they may cause postcoital bleeding, can be a sign of cervical or the vaginal cancer. So it is good at that particular time that one gets treated over the same, so that we get to encourage one to get a proper attention at that particular point, depending on the cause. So on the treatment part of it, if it is true trauma, and also if bleeding is due to vaginal tears or trauma, typically what happens, avoid sexual activity till that vaginal area heals, so that you don't cause further irritation. If there's an infection, if one has a STI or rather that chlamydia we talked about, gonorrhea and other conditions, it's very important that one gets a healthcare professional to get the proper full course of treatment as prescribed before engaging in the next sexual activity. If one has what we call cervical atropion, so most of the time when one has that misplacement of the cervical cells being outside the cervical area, normally it is not treated, but we have what you call cryotherapy, which is done and may be performed to reduce the size of the atropion. So if one has cervical polyps, if cervical polyps are the main cause of bleeding, these are removed in simple outpatient procedure called polypectomy, where one gets to be, those polyps are removed so that the comfort is reinstated. If one has hormonal imbalances, which can cause bleeding as the main cause of bleeding, medications are prescribed, especially by our gynecologists and also the doctors, to approach that kind of a problem in a very good way, so that one doesn't get into a lot of problems and discomfort, also bleeding during the sexual experience. On the cervical cancer, if cancer changes are suspected, further evaluation is recommended, so that one gets the proper treatment, and also if surgery is needed, if radiotherapy is needed, if chemotherapy is needed, the combination approaches are used so that one gets to approach that one. Also, on vaginal drainage, we have water-based replication like KY jelly, commonly here in Kenya. So where using water-based replicants during sexual activity help reduce the friction and irritation, so that it prevent dryness and associated bleeding. Though it is crucial to consult with the healthcare professional for accurate diagnosis and appropriate treatment plan tailored to your specific situations, so that you avoid self-diagnosis and self-treatment at that particular point. This may delay the necessary medical care and exacerbate underlying issues. So if you experience persistent and recurrent postcoital bleeding, it is good, very in order to seek proper medical attention for evaluation and also on management. We have some few complications of this vaginal bleeding. So because as a medical condition, when we explain them medically, so we also expect some complications to develop through this vaginal bleeding, and I'm going to mention just a few of them. So like with the complications of this problem, one is really the sexual activity is really compromised, and the complication is associated with the vaginal bleeding after sex or postcoital bleeding can vary depending on the cause, severity and the severity of the conditions. Some potential complications may include anxiety and stress as a complication of vaginal bleeding, because one wonders why am I bleeding? Even your partner may wonder what is happening, and this may cause anxiety and stress. So because of the persistent or recurrent postcoital bleeding, this can lead to anxiety and stress, affecting overall mental well-being and quality of life. You know, when you have anxiety and stress, your quality of life is really affected. Sexual dysfunction. Chronic postcoital bleeding may lead to sexual dysfunction, including decreased libido, avoidance of sexual activity, and a relationship strain. It comes out as a complication. Also, the infection spread can be there because of the bleeding. In cases where postcoital bleeding is caused by underlying infection, so untreated infection can lead to what we call pelvic inflammatory disease, and also other systemic infections if they remain untreated. So because of that root or the opening, you get that the infections come in, and also the recurrent infections or the increase of those infections can lead to what we call PID, or the pelvic inflammatory disease, which is not a very interesting thing to treat at some point, and it can lead to other complications such as infertility at some point. And also as a complication, delayed diagnosis of serious condition. In rare cases, postcoital bleeding may be a symptom of underlying conditions such as cervical and also vaginal cancer. So because you know cancer, when you delay making a diagnosis of it or discovering it, it leads to other problems, so that one gets into a problem of even now starting the course of treatment, because cancer spreads very fast, and if it is not discovered in time, one may be predisposed to very serious repercussions of treatment, and also may affect quality of life, or may lose life of that particular individual. Also, because delayed in diagnosis and treatment of these conditions can lead to disease progression and also poor outcomes at the end of the day. And also as a complication, impact on fertility. Depending on the underlying cause, chronic postcoital bleeding may affect fertility by interfering with ovulation, sperm transport, or implantation. So because of delayed or because of the condition of the bleeding, so the probability of one conceiving can be challenging at that particular point. Also, psychological impact as a complication. Postcoital bleeding can have significant psychological impact, causing distress, embarrassment, and also self-image. So one is really affected with this kind of a thing, because bleeding is not a comfortable, or it's not a walk in the park, and this can lead to one feeling unsafe and also really in distress and also embarrassed at some points. Because of the loss of blood as a complication, anemia comes in. Anemia is low blood in the body. So chronic or heavy postcoital bleeding can lead to iron deficiency anemia due to blood loss, resulting in symptoms such as fatigue. When one has anemia, she developed the fatigue, weakness, and also shortness of breath because of such kind of problem. So guys, vaginal bleeding can be caused by many things, and it's very important that you get to see your healthcare provider in case of any problem, because bleeding, we don't take it so lightly. so that the approach and also the treatment can be done as soon as possible, so that the approach or the treatment is given as soon as possible. So it is essential to seek medical attention if you experience vaginal bleeding after sex, and also especially if it is persistent, if it is recurrent, or accompanied by other concerning symptoms, because early diagnosis and appropriate treatment can prevent a complication and outcomes of the same. If you have concerns about postcoital bleeding or potential complications, kindly consult with a healthcare professional for evaluation and guidance. Guys, the channel is Nazvin. This is where we get to share matters health in a simple language which we can always understand, and they impact that life positively. Guys, welcome, supporters, and I want to welcome you to our next video. Guys, thank you very much.